to turn one of these patients over, which I have to do every day, it takes 6 people. And you go, why does it take 6 people? Well, they've got all these tubes.
New this morning, Governor Brad Little describing part of the treatment for intubated COVID patients in the intensive care unit. Those patients have to be turned over from their backs to their stomachs on a regular basis. And the governor recently visited the St. Luke's Boise ICU. Earlier this week, the governor announced he's adding hundreds of new medical personnel for Idaho hospitals that are overwhelmed with unvaccinated COVID-19 patients. The governor's office called the move a last-ditch effort to avoid the first-ever activation of statewide crisis standards of care. Under that, an Idahoan needing health care could receive a lesser standard of care or could be turned away altogether if there's no room. The governor said medical professionals would decide who will be treated and who will not. He toured the ICU the day before he announced the extra help for hospitals. And he talked with our Doug Petcash about his ICU visit during the taping of this week's Viewpoint.
Would you please describe in detail what you witnessed there?
Heartbreaking. The patients, they're all intubated. There's a few of them that are not fully intubated, but particularly the staff, how overwhelmed they are, how much trauma they see, patients dying, and it's really heartbreaking when you've got pregnant women and women with small children and spouses, they can't be with their loved one at this time, but this is not sustainable at this level to continue.
So what did the doctors and nurses tell you about how they're holding up and their morale?
It's again, very discouraging. That people that are not vaccinated are tying up their healthcare capacity, and that they've just, we have things happen. There'll be a spike in seasonal flu and some of the other things, but where we are in the calendar, what we're seeing in other parts of the state, I worry that some of these very dedicated nurses, respiratory therapists, fill in the blank, that their mental health, their strength, their resilience is going to be really tested. These patients, to turn one of these patients over, which I have to do every day, it takes 6 people. And you go, why does it take 6 people? Well, they've got all these tubes, multiple tubes that you have, you can't let them come out. And so, and these patients that have been in that position, they are not going to have full respiratory capacity, even if they do recover. And a lot of them are not going to have full mental capacity. And that's the urgency of these critical patients in the ICUs.
Really tough to see there. The governor also talked about other measures he's taken to fight this COVID case surge, the vaccination rate, masks in schools. How does he feel about that? And money for COVID testing in our schools. Join Doug for Viewpoint. You'll hear all of that from the governor this Sunday morning at 9 a.m. That's right after Meet the Press here on Channel 7.